This is a study with the combination of two bispecific antibodies, Teclistamab and talquetamab, for the treatment of relapsed refractory myeloma. And actually, this is the first time two bispecific antibodies have been combined to treat a heme malignancy, so it's really exciting. So this is a phase 1b trial, and we had an extensive dose escalation employed to reach the recommended phase 2 dose, RP2R. So each dose level employed step-up dosing as well to mitigate toxicity, and we ended up with a final dose of teclistamab at 3 milligrams per kg and talquetamab at 0.8 milligrams per kg. So the primary objective of the study was to look at safety, of course, being a phase 1b, and indeed it was very reassuring to confirm that the combination's safety profile was manageable and the toxicities were comparable to that of the monotherapies of teclistamab and talquetamab given as separate medications. The CRS rate was also similar to the monotherapies, and most of the CRS events were grade 1 and 2, and could be really controlled easily. About a quarter of the patients got teclistamab to control the CRSs, and they occurred mostly during the step-up dosing and during the first cycle. Infections occurred in about 80% of the patients, but less than 40% actually had a grade 3 to 4 AE. And the most common infections were COVID-19, pneumonia, and upper respiratory tract infection. There were 6 deaths due to infection on the trial. But overall, the safety was really manageable, and that it can be expected in this really tough to treat patient population. So there were 93 patients included on the study with 4 prior lines of therapy, and the median age was 65, and there was a large proportion, about a third of the patients, who had extramedullary disease, and this is really a tough kind of myeloma to treat. Also, about a quarter had prior BCMA exposure, and 90% were refractory to their last line of therapy. So really very refractory kind of patients. And the efficacy result had an overall response of 86%. In the entire cohort, and at the RP2R it was up to 96%, and this was over a follow-up of 14 months for the entire cohort. So this was really very encouraging, and at the data cutoff, actually over 60% of the patients remain on study. The responses were rapid. They occurred within 2 months. And they deepened over time, and actually the duration of response at RP2R was not reached, was not estimable. So I think these results are really encouraging, because this is the first time such a combination of bispecifics is studied, and one of the most interesting populations this might impact is those patients with the extramedullary disease. So we know this is a really tough patient population to treat, and in other studies the response rates varied between 5 to 40%, and here in this extramedullary disease patient, we had 85% response in the RP2R. So I think this is a big message for these tough patients. And indeed, there is already an expansion cohort that is planned for extramedullary disease. And I think these encouraging results will lead to further investigation of this combination in various settings of myeloma patients. And you know, as we always do in the myeloma field, we start with advanced patients, and then when we have success, we move up front. So perhaps this will also happen. I want to say that the durability of the responses is quite amazing, and patients are just living on, and these are patients I would have expected to have lost without this study. So it's really a great sense to be part of this. So it's really a privilege, and I think it's great news for the patients.